This is the opensource.club, a free St. Louis-focused knowledge share podcast. Through industry experts, entrepreneurs, personal stories, and more, we provide the information you need to achieve and thrive. Always visit our website, theopensource.club, for more details. Contact us on Facebook, Twitter, or LinkedIn.
When only 13 states require sex education to be medically accurate, a lot is left to interpretation in teenage health literacy. Research published by the Public Library of Science shows that when sex education is comprehensive, students feel more informed, make safer choices, and have healthier outcomes. This results in fewer unplanned pregnancies and more protection against sexually transmitted diseases and infections. While many teenagers pick up sexual health information from sources other than schools, like parents, peers, social media, and pop culture, sometimes that information is not accurate and is biased. I'm your host, Ruthie Zell, and this is Healthy You by the Open Source. This episode is sponsored by Planned Parenthood, a trusted healthcare provider and educator.
You're listening to Healthy You by the Open Source. Become a subscriber and hear all our shows. Go to www.theopensource.club and insert your email address in the podcast subscription window.
My guest today on Healthy You is Planned Parenthood's Director of Education for St. Louis and Southwest Missouri, Lynn Showton. A Washington University in St. Louis graduate, Lynn Showton specializes in sexual health and has been an educator for more than a decade. Lynn Showton created and currently directs the Sexual Health Interviewing Training for Washington University's School of Medicine's OB/GYN clerkship. Her job as Director of Education includes developing, implementing, and evaluating sexual health programs for individuals, classes, children, youth, and adults, no matter their abilities, identities, or backgrounds. Michelle, welcome to Healthy You.
Thank you for having me.
It's very good. I'm looking forward to this conversation. Now, your bio is pretty lengthy, so give our audience some more insight into your role at Planned Parenthood.
My role as director includes preparing staff, whether they be in the education department or our patient services department, to treat our patients and our students and our clients within our values with respect. I, of course, prepare and direct the education staff. Our team runs internal and external programs, and I direct the planning, implementation, and evaluation of those programs. We do external training for providers, such as medical students, youth-serving professionals, and we also do education for anyone aged 9 to 99.
So, you're covering the gamut in terms of age.
Yeah. Yes, we are.
Okay. So why is sex education so important? And I ask you that because many people shy away from the topic or think it's taboo.
I think that's really why it's so important, because a lot of us have shame, stigma, maybe just general discomfort around sexual health, our own sexuality, how do we talk about it? And so education is so important to empower us to know ourselves, know what we want, and understand and respect each other.
So how many participants do you have every year, and just how detailed is your sex ed program?
We have around 10,000 individuals, around annually 10,000 who participate in our programs. Again, a range of ages, a range of developmental stages and locations. Our programs can be as simple as a one-time session. We encourage a minimum of 4 sessions in the series, but we can come in one time if you need us to talk about STIs or consent and be your one-time guest speaker, or we have gone every single week for an entire school year to some schools. And the level of detail depends on the partner's needs and the participant's needs. I'm very proud of our program because we're able to modify and adjust it and tailor it to the needs of the audience versus saying, this is the one thing we offer, take it or leave it. We can make it very detailed as much as needed.
So, what are the requirements for participating in a sex ed course, and is there a cost attached to that?
We are funded by very generous grantors and donors. So for education services, there is no cost to the partner. Our training services, we have a suggested training fee, and also our mission is to provide services to everyone no matter what. We care no matter what, so we will work with people based on what budget they have, like at a university or something. The biggest barrier to participation, honestly, is negotiating schedule. Everyone's busy. We are busy. But once we get the time down, there's really little else to know. We, of course, have cooperative agreements that we sign with everyone. Our big thing is sometimes people want us to come and spread misinformation. Sometimes it's from a good place. They're worried about, the teens in their classroom, and they say, would you please come tell these young people that it will ruin their self-esteem if they have sex? Well, I'm not going to say that because it's not true for everybody. What I will do is talk about self-esteem, and I will talk to them about what are their values, what do they want to do, and empower them to only have sex if they want to in a safe, healthy, consensual environment. So that's really our only thing. We're here to provide medically accurate information. We're not here to push many values, not here to push any myths. We're here to empower every individual, no matter their age, to be an agent for their own sexual health.
I was surprised to learn that Planned Parenthood has a lot of partners for this program, including religious groups. So talk to me about those partnerships.
Yeah, we have some really amazing partners, some folks who've been with us for years. The religious groups is also interesting and really inspiring to me. For a lot of people, actually, their religion, spirituality, faith calls them to, then we need to have comprehensive, really, good sex education, and we need to empower individuals to be healthy and take ownership of their lives. We work with not just schools, but also a lot of community-based organizations, after-school programs, assisted living facilities, groups that serve all ages, all abilities. Yeah, there's a lot of folks.
So could you describe some of the topics the program covers?
I can, and these are well laid out on our website, which maybe is something that y'all are already going to share, but it is ppslr.org, and you can go to our education page, and we've got info on who we teach, what we teach, and there's actually a lot of stuff we can cover. So often I get to bust the myth that sex ed is only about STIs, pregnancy, body parts, and condoms. It's really actually about a lot more. So when I'm going into fourth grade class, I'm not talking to them about sex behaviors and what they can do with each other's bodies. That's not age or developmentally appropriate, and it's not really what they're interested in. They want to know about puberty. What can I expect? What the heck is even happening to my body right now? How do I stay a good friend? How do I make good friends? What is self-esteem? And maybe they're not using those words, but those are the subjects that we cover that they're interested in. So we will talk about body image, self-esteem, healthy relationships, communication. We talk a lot about consent, which there is a Missouri state law saying that schools need to teach about consent in their sex ed courses. We talk about identities, self-advocacy, responsibility. We, of course, talk about, what people think sex ed is. It's important. Pregnancy, birth control, STIs, barrier methods like condoms, testing, anatomy. One of my favorite things to teach about is media literacy. Especially now, it's so important for us to talk about sexting. Pornography honestly finds children. As young as age 8, people are non-consensually having pornography just show up on their electronic devices. So we teach about media literacy. We also teach about, where to go to get your answers because, fairly, they're not going to remember every word I say in that hour. So we give them skills to how to go find the answer to the questions they next have.
Yeah, this new media, it has just been really it's scary. I'm not a parent, but I would be freaking out knowing all the stuff that could come into my child's smartphone from nowhere. Yeah. And it is kind of dangerous. And children, especially when that age, and I'm sure you found that, but between elementary and junior high school, when all those changes start taking place, is that your most challenging age group to deal with?
That's my favorite age group to deal with. I would say it's complex and they can be squirrely, but it's in just the best way. I think because they have so much going on, they know they need it. I love everyone so much, and there are age groups where, I think like late teens, young adults are like, I know everything. I don't need to know what you're telling me. But 4th through 8th grade is like, oh, please tell us what is even happening. We're confused. And so I try to empower. I'm also not a parent, but I have a great deal of empathy for them. I helped raise my brothers and sisters, and we didn't have to deal with all this. So I try to empower caregivers to just, talk to your kids, make it not a one-time conversation. We actually have resources on our website and some of our partner websites to support caregivers and parents, because it should be more than one conversation. And so when we do middle school and early high school, we really want to make sure it's at least 4 classes. They may be a little shy, take a minute to warm up, and then just the questions keep coming, and we could do hours of just Q&A.
Tell me about another program I read about, the TASH program, TASH. What's that, and who's enrolled in that?
Yeah, that is Teen Advocates for Sexual Health. It is actually in its 20th year at our affiliate, which is it's a fantastic program. It is youth from 9th through 12th grade in the region who come together. Last year we had over 50 students involved, and we are building it to be virtual for at least this first semester because of COVID. But we will continue on, and they're a really interesting, passionate group of young people. Anyone's welcome as long as they are a teen and in high school. They are welcome to join. It's a place to get the comprehensive sex education you may not be getting in school. It's a place to build self-awareness, self-esteem, and advocacy skills, both for advocating your own needs, advocating with your school. And then also we go to Jefferson City every year and do a lobby day where the students get to practice speaking to their representatives about sexual health issues that are important to them. They meet twice a month throughout the entire school year. So about 22 times in a year they meet. We also do some Saturday retreats.
Sounds like they also get communications experience if they're basically lobbying. That's pretty advanced.
Yeah, absolutely. They do a training with our political team and our community engagement team to build some lobby day skills, and they're fearless. I thought it could be nerve-wracking, and they go on in. They are really assertive, and it's fantastic. They also get community service hours for it. So if that's something that, some schools require that for graduation, their engagement with TASH counts as community service hours, and will give a letter to the schools stating how many hours they completed.
Oh, that's certainly an incentive.
It is. We also give snacks whenever we're live.
That's a major incentive. One last question. Do you have any data on the benefits of a strong and accurate sexual health education program?
I do. There's information and resources on our website, especially our library page website, the Sun Library, that connects to this. But we know a few things that are just really key. Adolescents want sexual health. We know that sexual health, through studies of the past couple decades, we know that comprehensive sex ed that actually talks about sex behaviors and how to, protect yourself leads to not only increased prevention engagement, also it actually decreases when people initiate partnered sex. So if people learn about their bodies and learn about communication and learn about empowerment, they're less likely to start having sex with other people until later on. We also know that if we provide sex education that is empowering and inclusive of all, it can help reduce stigma and discrimination and, straight up bullying, especially against lesbian, gay, bisexual, transgender, asexual, queer, and questioning youth.
Mm-hmm.
We also know that good sex ed helps prevent intimate partner violence. Empowerment and teaching people what abuse is and isn't can help them have healthier relationships and prevent them from being abused or being abusers.
And that can make for healthier marriages down the road.
Absolutely. And we're about, healthier lives.
Absolutely. We've been talking to Michelle Lynn Showton. She's Director of Education at Planned Parenthood. I want to thank you for joining us and for all this valuable information.
Thank you so much for having me.
Perhaps it's time to dispel the misnomers about sex and learn about it. A solid sex education course reduces unwanted pregnancies, tamps down the potential for transmitted diseases and virus. To learn more about Michelle's sex education program, go to PlannedParenthood.org. My thanks to Michelle Lynn Showton for being a guest on Healthy You by The Open Source. I'm your host, Ruthie Zell.
Thank you for listening to the opensource.club podcast. Become a subscriber through RSS or YouTube. There's more to come that you won't want to miss. Our name is our web address, theopensource.club.